1 in every 2 men and 1 in every 3 women will face a cancer diagnosis in their lifetime. Key to improving outcomes for these people is timely and precise diagnosis. Here, we spotlight Lasker Laureates, who have given us new knowledge and technologies for cancer screening and diagnosis, improving the lives of the millions encountering this potentially fatal foe. One of the most notable advances in cancer control in the 20th century was the Pap smear test. Pap smears can detect cervical cancer long before the development of symptoms, and this early diagnosis facilitates timely therapy, identifying the disease when it is more treatable. Pap smears can even find precancerous cellular changes at a stage when proactive intervention can prevent cancer from ever developing in the first place. In tandem with other advances, Pap smears helped achieve a dramatic drop in cervical cancer mortality in screened populations. And today, cervical cancer can be prevented with the HPV vaccine, a clinical success that could relegate this tumor to being an illness of the past. Other screening and diagnostic advances stem from the breakthroughs in molecular genetics and DNA sequencing. Thanks to fundamental research discoveries and clinical innovations, genetic testing can identify individuals at increased risk of developing cancer. Genetic variations in specific genes have been linked to cancer initiation, growth, and metastasis. Susceptibility to some cancers in children and adults can be mapped to these genetic abnormalities. For example, scientists showed that the presence of the Philadelphia chromosome, an aberrant chromosome resulting from the translocation of a piece of chromosome 9 onto chromosome 22, is tightly linked to the development of chronic myelogenous leukemia. Similarly, breast cancer risk is elevated in patients with certain genetic alterations. The detection of harmful BRCA1 variants is strongly associated with the risk of cancer, and those with the variants can now elect proactive screening, prophylactic surgeries, and other interventions to mitigate their risk. Progress in diagnostic radiology also transformed cancer detection. Lasker-honored innovations have given clinicians new ways of managing cancer. Ultrasounds, computer tomography scans or CT scans, and magnetic resonance imaging, that is, MRI scans, all can diagnose cancer non-invasively, sparing patients from risky and expensive exploratory procedures. These scans can localize tumors earlier when they are more likely to respond to therapy, define the extent of disease more confidently, and help guide therapeutic decisions. We are indebted to the researchers and clinicians whose dedicated work has expanded our screening and diagnosis toolbox, and whose efforts allow people to live longer and healthier lives.